All right, we're right at 11 o'clock. I'd like to formally welcome everyone to the Penn State Clinical and Translational Science Institute's affiliates program orientation. My name is Dr. Wilson Brown. I am an associate professor of clinical psychology at Penn State Behrend. I am the Penn State CTSI affiliates program faculty lead. Joining me is Nicole Tarr here to the right on my screen, who is our program staff lead. As an affiliates program, we welcome both faculty, postdoctoral scholars, and research staff. Therefore, we have shared governance between a faculty member and a research staff member. So before we actually launch into our presentation, if you wouldn't mind taking a moment to pop in your name, your area of discipline, as well as your location across Penn State and where you're coming to us from this morning. We'd like to see who's representing our program, our affiliates program. So let's take a minute to do that. Again, if you're just joining us, please pop your name, your area of discipline, as well as your location, where you're joining us from this morning for our affiliates program orientation. I see we have UP, Harrisburg represented. Disciplines nursing, cancer, Penn State College of Medicine, Penn State Behrend. Nice to see you, Charisse, this morning. Nutritional sciences. Great Valley, welcome. Nice representation from Commonwealth campuses this morning. I think taking a look at this chat really epitomizes what our affiliates program is all about, which is to bring together the clinical and translational scientists at Penn State towards a common cause and to link them with Penn State's Clinical and Translational Science Institute. Nicole, if you wouldn't mind advancing our slide. If you are an affiliate, congratulations, welcome to our program. If you're not, an affiliate through our program consists of faculty members all across Penn State, as well as postdoctoral scholars and research staff who are interested in our shared mission and vision, or in a more sort of surface level interested in connecting with the CTSI on research projects and to gain access to CTSI resources, as well as the greater resource infrastructure of Penn State University. Our program supports clinical and translational researchers across Penn State, expands CTSI personnel representation beyond College of Medicine, the CTSI location in Hershey, as well as University Park representation, and establishes a formal network for members who conduct clinical and translational science at Penn State to connect with one another. Go ahead, Nicole. Our vision with respect to our program is to connect one another, us to each other, to connect the clinical and translational scientists across Penn State. And why do we do this? Well, that's part of our mission, which is to advance the larger CTSI mission to equitably distribute research efforts and the potential benefits to promote positive health outcomes for all Pennsylvanians. The CTSI is centrally located in Hershey, in our great state of Pennsylvania, but we have a number of locations, 24 to be exact, all across Penn State, where if we have CTSI representation, we are better able to reach all Pennsylvanians in rural, semi-rural, urban, and urban areas so that we can conduct this critical clinical and translational research for these individuals and involve our Penn State locations in the CTSI mission. Our goal as the program is to be the liaison arm for Penn State CTSI to Commonwealth campuses, to the College of Medicine, and to University Park, to ensure that we've created and sustained a collaborative network of personnel across Penn State that increases affiliate members' accessibility to us, the CTSI, to one another, to other researchers in clinical and translational science at Penn State, as well as the larger university resource infrastructure for research. Please advance slide. The objectives of our program, which was founded this past October, as you likely began joining if you are an affiliate since then, and if you have not joined yet, we'll provide more information about how to do so later on in our meeting, is to maintain continuous engagement with our members. We want a living community of communication where clinical and translational scientists, as part of our program, are communicating with one another based on their research needs, their interests, their requests for collaboration, their requests for resources, so that we can meet those needs and build those connections. So we're conducting higher quality research across disciplines. And those resources, which may not be available to us locally at University Park, at College of Medicine, and in particular our Commonwealth campuses, which sometimes feel a bit siloed, this mechanism allows us to communicate with one another across so that we can expand the capacity and scope of our research program. We also plan to offer affiliates exclusive programming, which I'll dive into here in a moment. This orientation is just the first part of that exclusive programming and understanding what the program is and what it does. We also will have mechanisms built into the program where you can request to be connected with particular resources or a research faculty member at Penn State. If you're looking for a statistician who has expertise in AI data modeling, for example, you can request that of us, and we will work to connect you with those folks, either through the CTSI overall research request form or the pending, which is in process of being created, CTSI affiliates research request form. Go ahead, Nicole. So our continuous engagement will consist of VIP communications. We plan to have monthly updates, the Affiliates Corner, in the CTSI newsletter. So if you've yet to subscribe to the CTSI listserv, please do so. That's where we'll be providing communication regarding a number of important updates and regular updates regarding our program. We also have a landing page on the CTSI website at Penn State, which is our affiliates program webpage, that will be expanded in a number of ways this upcoming year, and a researcher directory that will be part of our custom programming, where you can take a look at the other affiliates who belong to the CTSI affiliates program, their areas of interest, and potentially the needs that they may have in upcoming projects that they're working on. Go ahead, Nicole. As a part of our custom programming, we are planning a series of educational and outreach activities, virtual orientations, which will happen each year, as well as a series of didactics that focus on affiliates and how to build capacity and connection with interdisciplinary researchers in clinical and translational science across Penn State. We also have a number of didactic and virtual seminars planned where you can come simply meet and greet other affiliate researchers and talk about and workshop your potential ideas and how you might be able to connect with other researchers to actualize those research ideas, focused in particular on extramural funding. There are networking resources as well that consist of these events. We are developing a Microsoft Teams and SharePoint site for the affiliates program. This is going to be our home where our affiliates can connect with one another and see all the resources that we have access to, As part of this, there will be a directory, which we previously mentioned, as well as an affiliates chat where you can pop in a request or say, I'm looking for a researcher in this area. Does anybody know of anyone, or is anybody interested in collaborating on this particular type of project? Please let me know. In addition, we're working on some things with the CTSI administration in how to potentially support extramural funding applications that are submitted with CTSI assistance from CTSI affiliates. Our collaborative research network that we're creating, we want to connect our members to resources through the CTSI and potential collaborators in an effort to expand the CTSI research capacity. Our CTSI specializes in particular in the investigation of problems that influence rural health. And Pennsylvania is one of the most rural states in the United States. And we are very fortunate to have a CTSI with that type of mission. But one of the limitations of our CTSI is the ability to truly reach all rural communities in Pennsylvania. And we can do that by making connections with our Commonwealth campuses and folks that do clinical and translational research there. We are potentially working on mechanisms as well to identify CTSI affiliate program leads at Commonwealth campuses that have the capacity to host CTSI-funded research projects. So stay tuned for those updates as they develop. The affiliate sites that I'm mentioning as they develop potentially will be targeted for larger funding initiatives through the CTSI in connection with other programs such as the Community Engaged Research Corps and so on. To become a member, if you are not yet a member, you have to be current Penn State faculty, a postdoctoral scholar, or research staff. You must conduct clinical or translational research. If you're not sure what that means, there's a definition of it on Penn State CTSI webpage. It's very broad, loose. If you've connected with the CTSI before, it's likely that you conduct clinical and translational research. Also, our members will participate in a brief programmatic evaluation annually. We want to know what you're doing each year that connects with the CTSI. We want to know how our program can better help you. And without that data, we're just unable to make those really important decisions about how to develop our program further to best suit the affiliate needs. We are also interested in building an internal review mechanism through the affiliates program when our members and other members of the CTSI are developing extramural funding applications. A mechanism to internally review those applications before they are submitted to the funding source so that the applications that are coming out of the CTSI are of higher quality and your applications are of higher quality. Member benefits. This is what we're all here for. This is what we're here to discuss. First and foremost, this is the first mechanism to formalize CTSI involvement for faculty and staff who aren't CTSI employees. This is internal and external recognition for CTSI involvement for folks who are involved. And this is long overdue for individuals who are routinely collaborating with the CTSI, but not necessarily, they don't have a formal title or a recognition of such collaboration. It expands access to CTSI resources immediately and increased contact with core CTSI personnel, some of whom are here with us today. And you'll hear from the CTSI director, Jen Kraschnewski, here in a few moments. It offers interdisciplinary opportunities for research and community outreach, both in your community and in other communities in Pennsylvania that are targeted communities for CTSI research initiatives. Offers you a broader platform for your research efforts, to invite collaborators to your research and to disseminate it amongst both Penn State researchers and other types of scientific communities, depending on the interdisciplinary connections that you make. And of course, enhanced support for manuscript preparation and internal, external funding applications, which I've hit on. There are some brief and additional benefits for research staff as well, which I'd like Nicole to speak a bit about as a staff member with CTSI herself.
Sure. Thank you, Wilson. Hi, everyone. As Wilson said in the beginning, my name is Nicole Tarr. I'm the staff lead for the CTSI affiliates program. So the benefits that we have listed here on the slide are both for faculty and staff that join the affiliates program. But in addition to what we have listed here, thinking about benefits from a staff perspective, the professional networking opportunities with other research staff, both across the university and campuses beyond the location or department that you currently work for is going to be a major benefit for staff that join as a CTSI affiliate. Along those same lines in terms of networking, becoming an affiliate as a staff member will also expose you to additional projects and faculty working in areas that may align well with your interests. So making new connections with faculty here at Penn State will be a benefit for staff as well.
Thank you, Nicole. Now, if you wouldn't mind, you can go ahead and advance. And so I am pleased to present to our attendees this morning, Dr. Jen Kraschnewski, who is our current CTSI director here at Penn State. Dr. Kraschnewski is here this morning to speak to our affiliate members about the connection of the affiliates program, sort of where it's nested in the CTSI and the resources of the CTSI that become available to you as an affiliate member. Dr. Kraschnewski, if you are...
Thank you so much, Dr. Brown. So first
Of
of all,
course.
Wilson and Nicole, you two are fabulous. So as you can tell, they have a lot of energy around this program. They've thought a lot about this program. And I just have to give a huge shout out to Wilson. He approached me maybe a year and a half ago now and said, hey, I have this idea. The CTSI is doing so many great things, and I don't know if they're getting past the College of Medicine and University Park. What do you think about an affiliates program? And there was no way I could say no to his pitch and his enthusiasm. So I know this comes from a space where Wilson and Nicole are both really committed to understanding how we can better support research across the broader We Are Penn State University. My task is to just give you a little bit of background. There's no way I could talk through all of the resources we have, but I do want to highlight a couple of things for you. One thing we've been really focused on in the CTSI is helping to build community engaged research. And one of the key ways of doing that, of course, is through community partnerships. So we have a couple of different programs where we have already established these partnerships. As a community engaged researcher myself, I know the timeline it takes to have very real and meaningful collaborations in the community. And one of my favorite stories is the work that we did in Lebanon County, which is just to the east of us here at the College of Medicine. It literally took us 5 years of embedding ourselves in that community, supported through bits and pieces of different types of projects before we were prepared with our community partners to apply for the first large external funding. And that's a time course that just doesn't work for early career faculty very well in our current system. So my goal has always been in this space to see how we can benefit from folks who have already done that legwork and make this easier for our newer generation of researchers, or a generation of researchers who's interested in shifting into the community engaged space. That's always welcome as well. That being said, we've grown our listserv of community partners from not very many to start with to over 800 that really branch across the state. So we certainly don't know all of the community partners, but the cool thing about that 800 is every single person who responded to our survey said they would be interested in learning more about opportunities in collaboration with Penn State, which is a wonderful statistic based on the trust that people have through their established relationships with our university and what they think we can all do more together with. So if that's a space for your interest, please let us know. I know Wilson already mentioned biostatistics as one of the places. We also have wonderful expertise in informatics. On our College of Medicine and University Park campuses, we do have clinical research centers. And so those may be spaces if you have interest in doing formal clinical trials that may be of interest to you. Our dream is to decentralize those clinical trials. And we've done some early testing of this in partnership with Mike McShane and his mobile clinic, which you may have seen, Lion Mobile. Our wonderful president highlighted it in a video right before the holidays. So we've been partnering with Mike over the last 2 years to really explore how we can bring more research out to rural communities using this approach. In addition, we have a number of different seminar series that may be of interest to you. So we have our biostatistical epidemiology and research design series. And I love this series. It's in the fall and the spring, up to about 10 different topics that are covered. And when I became director, I thought, gosh, we shouldn't just let these be one-time events. So not only are these on Zoom where you can join live and ask questions, we also have a wonderful YouTube library of all of our prior seminars that you are welcome to peruse. You're welcome to share with your colleagues, your students. I know the last time I checked, which has been a little while, one from a year or so ago by Dr. Vern Chinchilli on randomized controlled trials had over 1,000 views. So some of these topics just don't get old. So you can learn from them, even if they are a year or two old. And of course, that group is always refreshing. They just announced their latest spring series in our newsletter. In addition, we have a real focus on team science. And I found that we're unique amongst the research institutes in this space. We are so lucky to have Dr. Susan Simpkins as our team science expert. And she does a series called 5 or 10 minutes sometimes of team science. And these are short little snippets. These videos are also available for you on the YouTube site. And we'll put the link in the chat in a moment. So those 10 minutes of team science are easy little snippets that you for sure take a peek at them yourselves, but then you can insert them into any project meetings you have. Maybe you want to offer them to your department as a learning pearl in that space. But I have found these incredibly helpful in a time when we use a lot of our time in meetings such as this. How do you make meetings more effective? That's one of her topics. How do you work better across interdisciplinary teams? That's another topic that's covered. So lots of opportunities for learning in that space as well. And then, of course, we have our Translational Science Seminar Series, which is a mouthful. We call it TSS for short, which is much easier to say. And those are topics that really span across the translational science spectrum. Some of those are internal, some of those are external series leads who have given us talks. You can peruse that entire library as well. In addition, we have just introduced our focus on JEDI-B, or Justice, Equity, Diversity, Inclusion, and Belonging. And we're so fortunate to have Dr. Rafi Lucas, who is at Penn State Harrisburg, as our director of this program. He's offered a 4th seminar series called Amplifying Lion Voices, where we have a chance to hear. It's a little different from our other series. It's really focused on the pathways of some of our wonderful faculty who come from different backgrounds to share their journeys throughout their scientific career. So please check those out. And if you know of anyone else who would be a great person to feature for those, maybe even yourself, please don't hesitate to reach out. So I think with that, that is kind of some of the highlights. Again, there's more than I can cover here, but we do have a couple of handouts as well that can give you a little more information. We've tried to do our best to make these resources equipped in a way that you can easily access them. One more before I turn it back. I will say we have the wonderful Abby Fisher as our research navigator. And Abby is, if you haven't met her yet, please do take time. I'm hoping I can phone a friend here on the CTSI team to put that link in the chat for connecting with Abby. But she is a wonderful resource for reaching out. If you have a need and you're not exactly sure where to go, she can help make sure you're connected throughout the CTSI resources, or even more broadly if it's outside of our CTSI scope. Oh, and look at Abby taking care of that for me. Thank you, Abby. Appreciate it. With that, again, just a warm welcome. Thank you for joining us today. Thank you for your interest in more of the resources that we have available. We're really looking to support the work that you do. I think my belief as a leader is we're stronger always when we work together and we break down some of the silos, whether they're intentional or just they've always been there. And we look for ways that we can work across our wonderful university spectrum. So thank you again for your time. And back to you, Wilson and Nicole.
Thank you for your time, Jen, and we are so grateful for your support, the CTSI support of our program to expand CTSI capacity. And I would be remiss if I didn't mention that journey to connect to resources through Penn State as a Commonwealth campus faculty member and early in my career was a challenge. And it actually wasn't until I applied and was accepted as a CTSI Community Engaged Research Corps fellow that I was actually able to better connect with those resources and sort of have a bigger footprint at Penn State with respect to my own research program. The CTSI has numerous faculty fellowship support mechanisms, resources, and so on for early career faculty. But there just was not a very good avenue for connecting with those things for Commonwealth campus faculty members. And oftentimes Commonwealth campus faculty members and research staff didn't think they would be eligible for those types of programs. We're here to let you know that you are. We're here to let you know what programs are available to you, and we're here to connect you with those programs. So in the spirit of connectedness, within our program and also within connectedness in the larger CTSI seminars, didactics, so on, we have a breakout activity for our affiliate members this morning, where we're eager to hear a bit about what you're hoping to see from the affiliates program as an affiliate. So in a moment, Nicole is going to assign folks to a breakout room. And in your breakout room, I just ask that you introduce yourself, who you are, where you're coming from, and a bit about your research. And then as a group, discussing both A, how your research connects to the CTSI, and B, what are you hoping to see from the affiliates program? We will then come back together and discuss the feedback that folks have provided regarding what you're hoping to see from that program. So again, if that was a more detailed explanation than you were ready for on a Monday morning, simple introductions. Who are you? What do you do? And what are you hoping to get out of our program, the affiliates program here? And take note, this might be a valuable opportunity to hear a little bit more from your faculty members at other locations in your breakout groups that you may not know, who could be potential collaborators in the future. So Nicole, if you wouldn't mind sweeping us away into our breakout rooms here.
Absolutely. Okay, we will see you all back in about 10 minutes. Okay, it looks like that mostly worked.
I'm going to hop into a room without CTSI representation. So
Okay, are there any others? Because I was going to offer that too. Do you need?
it looks like there are a couple. We have 6. So I'll go into room 6 here.
Okay, Jen, do you want to go into room 5?
Sure. I didn't know if it would change
You
the
have-
dynamic, so I kept
Oh,
myself out. So, but I'm happy to if there's nobody else in there.
or actually even 4. I didn't even realize you were in a group. You can go to 4.
I can
Okay.
go to 5, Nicole.
Okay, cool. Thank you. Let's see. Where should I go? Okay, Abby's in 3. I'll go to 2.
my God.
Jump from one slide.
Nicole, can we pull down the slides for our large group question and answer session here? Welcome back, everybody. Thank you so much for your interest as well in our presentation and in sharing your background experiences with your potential collaborators here at Penn State. We want to open this up first to hear a little bit. I think we had CTSI members in most groups. If we wouldn't mind getting a 30-second summary of some of the points that our CTSI members caught in their particular groups. And I'm happy to start. So I was in group 6. It was shared that there's a definitive appetite for folks to connect with data sources, other faculty members who are already embedded within their communities, who may be working more in a siloed fashion, but have more data than they know what to do with, and the need for folks to answer those questions and assist with them and partner. There's also a question around whether or not individuals outside of Penn State could be an affiliate. At this point, we don't have a mechanism for that, but this is an issue that's already come up more than once, and we are engaging in preliminary discussions about how to support both community partner organizations. We have a community partner list for the CTSI, but individual scientists looking to collaborate with our CTSI and our affiliates program who are not Penn State researchers, who may be from sort of smaller colleges in Pennsylvania or other institutions as well. So that's something that I hope to provide more updates on through the year as we continue to think about how to best expand capacity and really support such an initiative. Do we have any other folks reporting back? Nicole?
Sure. Yeah, I can go next. So my group also reported on something similar, Wilson, in terms of data access and also help with statistical analyses. We also talked about having the membership list and access to affiliates, a list of affiliates and the projects that they work on, the research spaces that they work in, so folks can collaborate across campuses. That was a big interest for our group. And then also access to external funding opportunities. So learning about funding opportunities and collaborating with other folks on submitting external grants, and also help for students and mentees, med students, MPH students, fellows, in terms of data access and statistical analyses, and all of the other wonderful resources that CTSI offers.
Thanks, Nicole.
I can go next. So our group had a delightful conversation. I was really happy to hear that they were excited to join for a lot of the same reasons that you already both shared. Maybe one addition is thinking through, how can we help kind of take the support that people have in their colleges to the next level. And I would say a broader answer to that is, while the colleges all function in incredibly supportive ways to your grant proposal submissions, what we envision is that we can help with those connections that may go beyond what folks you work with every day know in terms of people and resources. We're always happy to provide letters of support for your grants if you think that'll be helpful. We do have pilot funding. I should have mentioned that in my kickoff, but we do offer pilot funding to support research as well. We can do matchmaking. We can connect you with resources even in the grant writing process to help strengthen your proposals. So I would say that would be the one additional plug that I'll put in there. And we had an offer from one of our wonderful colleagues that they're looking for problems to solve with their AI and machine learning approach. So if you have an AI problem, I saw a hand raised from Erica Husser there. So, we can already do some matchmaking early on here. So we want to learn from you. So this may be the first time that we're asking, but please don't take it as the only opportunity to have your voice heard. This program is only as strong as the feedback that we receive from all of you and how we can make it better.
Excellent points, Jen. Thank you so much. Other reports, Kelsey?
Yeah, I can go next. Our group had a lot of similar conversations as to what's already been shared, hoping to leverage the group to apply for some larger cross-disciplinary, cross-campus grants. And being here to support each other is another thing. You know, we all have certain knowledge from our campuses or our discipline that we can share with others, which can help to overcome some of those, what Jen always calls it, the blue tape at Penn State. So knowing what to do and when to do it and the processes involved in building those connections. And yeah, learning about new topics, solving problems, and really networking is that biggest piece that people are looking to do because we all live in our own little areas and we want to be able to connect with others.
Thank you so much, Kelsey.
I can go next. So I love that term blue tape. I hadn't heard that before, so I'm going to borrow that from now on. So I had the pleasure of working with Group 3, who is awesome, and we're already right. Thanks, Jen. So we already formed some like a mini networking group among the 3 faculty who were able to join us. So in addition to what everyone else said, I think a couple of other kind of what they're hoping to get out of the program or goals that they have for the program are supporting early career faculty who may be moving into a mid-career, and what resources, what guidance can be provided as you make that transition. Someone mentioned wanting to do really impactful and non-ivory tower research. So how we can facilitate that more meaningful research to really have an impact. And then also there was confirming that we'd love to share everyone's contact information if possible to do some of that direct outreach and share the contact info as well as the topics of research that you all are working on, to maybe do some more direct networking. And then also access to resources. And one of our folks has a co-appointment in the Penn State Extension, which I didn't even know was a thing. So I think leveraging our connections to the Extension group and the work that they're doing directly in communities would be really, really helpful as well.
Thank you so much, CTSI staff personnel, for summarizing, participating. Just a few quick notes before we provide an opportunity for questions. The SharePoint site in Microsoft Teams is currently in development. That will be our home. If you are an affiliate member, you will automatically have access to that once it's created. So keep an eye out in your email in the next month or so for an invitation to join or to access. And of course, it's new, so resources will be added as they become available. Second, our affiliates program is new, and it hasn't reached the ears of all of our Penn State faculty, staff, and postdoctoral scholars who are working in the clinical and translational science space, especially in some of the Commonwealth campuses where lots of clinical and translational research is being done, but they just don't feel well connected with University Park College of Medicine and the CTSI. So if you have colleagues or collaborators that are not yet members, please reach out to them with our application link and let them know that this is a valuable resource they can utilize to better connect with Penn State and the CTSI. We become stronger as our affiliate numbers grow, and that expands our capacity to do larger projects of scale and scope. So I'd like to open up the discussion for questions from our affiliate members, for myself, Nicole as the staff lead, or even Jen as director of CTSI.
Yeah, so Wilson, I have a question. So people like myself who are already at the College of Medicine, we're technically not affiliates, but should we be affiliates here as well? And so in other words, I think that being a affiliate who is already a member, let's say who's already at the College of Medicine or the CTSI, there may be some added advantages of being affiliate just by being part of the the emails that get circulated and newsletters and other things like that. So, or maybe Jen can answer that question, but for someone like myself, should I also be an affiliate?
We have discussed this at length and determined that yes, College of Medicine faculty are eligible for affiliate status. Why? Well, some College of medicine faculty may work in this space, but be seeking external collaboration that they wouldn't otherwise be able to access through the sort of traditional avenues. And the affiliates program provides the opportunity for those collaborations. And so we are looking to support folks who want to connect, who want to collaborate, who want to meet folks from other campuses, who want to do research in communities beyond their own that they're not embedded in already. And so we discussed, debated, and expanded it to faculty members, postdoctoral scholars, and research staff at all Penn State locations. We are, right? Other questions?
I kind of have a question. One way I feel that could be connected is linking people with the special skills with other people who need the special skills. I think that is important, and I'm always unclear about member versus affiliate since they're not the same. Our members faculty. I missed the first part of or is it members necessary people with a doctor, right, like I am, who's a staff member? That would not be a member per se.
We've been using the term interchangeably. An affiliate, you're an affiliate, right? The distinction is between CTSI staff and personnel who have paid appointments through the CTSI, right? And so that distinction is core. Nathaniel, we're actually hoping through our Microsoft Teams chat to create threads for two different things. One, people to ask if there is somebody in the affiliates group with specialized skills who are interested in collaborating, and two, people with specialized skills who can make themselves available and say, I have this skill, I'm looking to collaborate, I'm really interested in a broad number of topics or any topic, please reach out if you're interested. So that is what our SharePoint and Teams chat function is going to be utilized for those types of exchanges. So individuals can let the other affiliates know when they have availability, when they're looking to collaborate, and what skills they have and that they're looking to leverage in those collaborations.
Thank you very much for that. I tend to be more of a methods person versus a topics person. So methods people are very interchangeably depending on the subject. So that's how I got 30 papers in different topics because I'm a Methodist. No, methodologist, not Methodist.
Of course. Thank you. We had a question in the chat. Erica, thank you. The difference between translational research and implementation science, there's certainly overlapping fields and disciplines. There is an implementation group at the CTSI. There are different stages of translational research that implementation occurs. So they're overlapping, but not all implementation research is translational research. So I think that's the defining difference. But we could certainly get into a more philosophical discussion about the distinctions between those two. But implementation science does fit well within the scope of what clinical and translational science is.
Yeah, and I'll add one more term just to blow your mind a little further, is translational science. So the NIH has really pushed the CTSAs like ourselves to think about translational science, which is even a broader discussion than translational research. So I think about translational research as something that takes a research question from one stage to another. And so we typically use like the translational spectrum of T1 through T4, meaning bench to bedside to clinic to community is usually the way I describe it. So those are T1 through T4. Translational science is this concept that translational research question typically focuses on one disease condition or one patient population, whereas translational science can think about the challenges of translational research. So, for example, a translational science question might be, how do we do a better job recruiting participants into studies? It's not focused on any one disease, but you could answer it through a translational research question, like maybe a study that you're doing with patients with substance use disorder, for example. Implementation science is much more specific of using evidence-based practices and studying how to most effectively disseminate those in the real world. And so that's more on the T3, T4 side of the translational spectrum. But we use implementation science a lot. And one of the many cores, because I didn't get to them all in my little spiel, is we do have an implementation science core led by an incredible implementation scientist, Dr. William Callow. So if that's something you're interested in learning more about, we also have a fellowship program, which is open to any Penn State faculty in both community engaged research. And we've had a number of those community engaged research fellows come from Commonwealth campuses, and also now a new one in implementation science. So those fellowships buy out a section of your time. It's a course buyout each semester for a year to really help you learn those micro career development program that helps you build those skills in your research portfolio. Oh, Kelsey, you're so good. Yeah. So we've got this video on translational research versus translational science, but don't worry, you're all in, even if you don't understand. So we're here to help you understand better as you think about proposal mechanisms that may ask you this.
We're just about at time. So Nicole, if you wouldn't mind pulling up our contact information, if there are additional questions, as we round out our meeting, I just want to thank everybody for your interest and involvement in the program. If you had a colleague that wished they could attend today's seminar, but they were unable to, we've recorded it. So that will be posted in the coming days, and the link to review and watch it will be available. We'll make that available through our channels that we're already distributing information from. Otherwise, please encourage others to join. Please ask your questions. Please reach out if we can be of service to you as an affiliates program. And we look forward to growing together with each of you. Thank you again for attending, and we wish everybody the best of the week.
Great job, Wilson and Nicole. Thank you.
Yes, thank you for your time, Jen. Thank you so much for your time.
Of course. It was fun hearing the